Tranexamic acid is best known as a medication used to reduce bleeding, but in dermatology, it has become one of the most effective treatments for stubborn pigmentation, particularly melasma. In this video, I'll explain why tranexamic acid works for pigment, how it's used in aesthetic practice, and who it's appropriate for. Mechanism of action. From a biological standpoint, tranexamic acid works by inhibiting the conversion of plasminogen to plasmin. Why does that matter for skin? Plasmin plays a role in UV-induced melanocyte activation, inflammation, and abnormal vascular signaling, all of which are key drivers of melasma and post-inflammatory hyperpigmentation. By reducing these pathways, tranexamic acid doesn't just fade pigment, it reduces the stimulus that causes pigment to keep coming back. Clinical indications. This is why tranexamic acid has the strongest evidence for melasma, particularly recurrent or treatment-resistant cases. It's also commonly used for post-inflammatory hyperpigmentation, prevention of pigmentation after laser or energy-based treatments, and certain inflammatory pigmentary conditions. In some patients, it can also improve post-acne redness and vascular-driven erythema, such as in early rosacea. Forms of use. Clinically, tranexamic acid can be used in several ways. Oral tranexamic acid has the strongest evidence for melasma, but it must be prescribed carefully and for limited durations. Topical tranexamic acid is widely used in pigment creams and serums and is safer for long-term maintenance or higher-risk patients. Intradermal or mesotherapy delivery allows targeted treatment in resistant areas or as an adjunct to lasers. Importantly, tranexamic acid works best as part of a combination approach, alongside sun protection, pigment suppressors, and appropriate procedures. Safety and patient selection. While tranexamic acid is generally well tolerated, patient selection is critical. Oral use is avoided in patients with a history of thrombosis, clotting disorders, or during pregnancy. This is why a proper medical assessment is essential, and why topical options are often preferred when systemic risk exists. Key takeaway. In summary, tranexamic acid is effective because it targets the underlying biological drivers of pigmentation, not just the pigment itself. Used appropriately, it can significantly improve outcomes in melasma and difficult pigment conditions. If you're interested in evidence-based skin treatments, follow for more medically grounded aesthetic education.